Hello, I'm Dr. Charles Daknis. I'm an interventional pain management physician. I trained at Hahnemann Hospital at now Drexel University back in the early 90s. Finished up there, went to Albany Medical Center where I trained in neurosurgery and anesthesia. I finished as chief resident in anesthesia and went to Brigham and Women's Hospital through the Harvard system for my interventional pain management training. Since the late 90s, now almost 16, 17 years, I've been doing full-time interventional pain management and have brought to bear a lot of expertise from the Harvard system to my patients here with Spine Surgery Associates, offices in Bedminster as well as Newton. And I'm very, very pleased to be working with Drs. Dwyer, Dr. Vessa, as well as Dr. Choi to deliver an excellent quality of medicine and an excellent result for our patients. I see a lot of young athletes, and they are all very stoic individuals. They're tough. They're in good shape. Maybe they have a slip disc, or they blow out a disc. They have sciatica, and almost to a man or woman, they say, "I can tolerate it. I'm fine. I'm able to live my life." But you start to ask them, "Well, what are you doing?" "Well, I don't run as fast as I used to do," or maybe I don't go out with my friends as much as I used to because it hurts. And I've changed my lifestyle as a result. And I usually end up saying to them, "Look, you're going to spend your time altering your lifestyle when we could do a relatively simple procedure to alleviate that for you. Even if it means you having to go through a minimally invasive surgery." And when I say minimally invasive, I mean incisions less than 1 inch or smaller than that, even with some of the endoscopic techniques we can do. You can go through a technique like that and alleviate your problem rather than suffering with it. And even then, some of the tougher folks will say, "I don't want to have any surgery done. I want to avoid it at all costs. So I don't want to have any procedures done because I'm A, afraid of going through the procedure, and B, scared it may not work so well." And what I usually say to them is, "All right, well, you know what? There's always a risk involved in anything that you do. But I can tell you let that nerve remain damaged. It doesn't matter, you let it remain damaged as long enough. It doesn't matter what we do because it's going to be damaged. And you're going to have to live with those symptoms for the rest of your life if you allow it to continue on for long periods of time." Well, the good thing about this practice is that we have multiple facets all under one roof. We have the interventional pain management from my perspective. We have rehabilitation, physical medicine from Dr. Choi's perspective. And we have the surgical standpoint with Drs. Vessa and Dr. Dwyer. And we also have psychological services that address the human component. And having a spine problem addresses all those issues. The suffering, the human suffering can be addressed by our psychologists, and the rehabilitation concerns by Dr. Choi, and the interventional pain management techniques by myself. And if surgery is necessary, and only if surgery is necessary, Drs. Vessa and Dwyer can take care of that. So I think that sets us apart in that we sit down around a table very much like the one I'm leaning against, and we discuss our patients, and we talk about all those facets of their particular problem and how they're doing. That really sets us light years above and beyond what our competitors are doing and what other practices in general are doing. So what do I enjoy most about my specialty? Well, it all goes back to the lion and the mouse. Lion and the mouse. The lion gets a thorn in his paw and he's in terrible pain. And he can't do anything. He can't be king of the forest. He can't, take care of his kingdom. But little mouse comes along, takes that thorn out, changes his life. And I'll tell you what, that's what it's all about for me. It's making people's lives whole again, allowing them to do the things that they love, to be the people that they are, and to be the people that their loved ones know them as. Because pain can change you. It doesn't just hurt. It can fully change your personality and make you into somebody that you don't want to be. And it's the most rewarding thing ever to be able to restore somebody's personality, take them out of pain, and allow them to live a full, productive, happy life within the love of their family, and to do the things that they like to do as well without being burdened by terrible pain.